Well, good morning, everyone. Thank you very much for joining us today. And as you know, for the last number of weeks and months, we've been monitoring COVID-19 in other provinces and territories across the country very, very closely. We've watched as the case count increased in every single province and territory. And we've watched provinces abandon contact tracing as the number of cases has grown to a point where their systems were not able to keep pace with the number of cases in their provinces. We've watched as restrictions tighten, businesses close, sporting events are canceled, and cohorts of students in schools are sent home and moved to online learning because of positive cases. This is, by all accounts, the second wave that we've been waiting and anticipating. This is what Dr. Morrison and others had warned us about throughout the spring and the summer months. And this is a very pivotal time in the epidemiology of this pandemic in this country. Back in April when we were here, I used the analogy of being in a hockey game and how we had only finished the first period. And I guess now to continue that, we're heading into the third period, I suppose, with a good solid lead, but it only takes one bad shift or one moment of letting our guard down to jeopardize the lead that we have. And this isn't the time to brag or boast about our success, but it is a time for us to put our heads down and keep doing what we've been doing, keep doing our job in the face of this pandemic. Islanders have, since day one, responded very positively to the advice of Dr. Morrison and her team. We've seen compliance perhaps like no other jurisdiction in the country, and we have seen the success that we have been able to achieve with such strong compliance. We've kept our border screening in place to ensure that anyone coming from outside the Atlantic bubble is flagged with our public health office. We've kept Operation Isolation in place to follow individuals daily who are in self-isolation to ensure that they are compliant and feel supported during their isolation period. We must not forget that we shut down this spring. We did that to allow us to create capacity in our healthcare system to establish new processes, to change the way we operate as a society, and to ensure our retail outlets, our fitness centers, and our schools were properly equipped to protect Islanders when future outbreaks were to occur. And so far, we have been able to demonstrate that we can manage in times of COVID when it has arisen here. We've expanded our testing capacity to include anyone with symptoms and have expanded the testing sites to ensure adequate access to testing. We are one of the very few provinces that has been able to create a system where Islanders can get their COVID-19 test results online, often within 24 hours of doing a test. We've responded quickly and efficiently and effectively in this province, and our public health office has worked around the clock to give us every opportunity to be successful and to avoid another lockdown. However, things outside of our provincial borders and outside of our Atlantic bubble are hitting a critical point. The daily average case counts in our country is now double what it was in the first wave. We've seen every province and territory have an increase in cases in the last number of weeks. Our neighbors in Nova Scotia have their first cases in the school system yesterday. Our neighbors in New Brunswick have had to respond to multiple outbreaks in schools and healthcare facilities. Our friends in Nunavut have just had their first case of COVID-19 on November 6th. And now today, only 12 days later, they are seeing evidence of community transmission, and they are going into a complete lockdown after 8 months of strong border control and keeping the virus at bay. Although we are doing okay on this precious island, we can't ignore what we are seeing across the country, and we need to be mindful, ever mindful, that we can't pretend that we are immune, and we can't avoid the reality that we are in the midst of a second wave, and it's perhaps just a matter of time before it starts to affect us here at home. For those reasons, and many others, Dr. Morrison met this morning with our cabinet, and the following increased measures have been approved for a temporary time and will be reflective of the updated public health order that will take effect as of midnight on Thursday, November the 19th. These measures will be put in place until February 15th or at such time as it's determined we can relax them, and we will reevaluate our measures as we do daily. But we will be moving toward mandatory masks later this week. Dr. Morrison will provide further details on this shortly. Starting on Friday, additional information will also be provided to those who are visiting or re-entering this province. We will be advising them that masks are now mandatory in all public places. This will require additional personnel and resources to ensure a safe and timely process at our entry points, but I would ask that everyone continue to be patient when entering or returning to our province as our border screening teams complete this very important work. Visitors to our province will be encouraged to download the COVID-19 Alert app on their smartphones. This app has been proven to be another tool in our toolbox to ensure that individuals know of other potential and possible exposures of the virus in a timely manner. In the upcoming days, Dr. Morrison and the public health team will be working with the long-term care and community care sectors to discuss potential changes for visitation to balance the safety and well-being for these vulnerable islanders. We are also asking islanders to be mindful of the current situation across the country if they are planning on traveling outside of the Atlantic bubble between now and January 15th. There is a greater risk of infection outside of the Atlantic bubble, and most provinces outside of the bubble are seeing community spread of the virus. I know this is a challenging time to be apart from family and friends, especially with the holiday season coming. But in due time, our country will flatten the curve of this second wave, and travel will be much safer once the case counts start to decline in our country. For those islanders who feel they do need to travel outside of the Atlantic bubble for the holidays, we are asking you to apply for re-entry by December 1st at the latest. This is important to provide us with the necessary data and information to allow us to adequately plan for the return after the holidays and to ensure resources such as Operation Isolation, testing clinics, and border screening are able to keep pace with the re-entries in our province. This announcement is not an easy one for us to make, not because of what we are asking islanders to do, but mainly because it is of no fault of our own or anyone in this province that we've had to impose further restrictions. But the reality is, and I continue to ask all islanders to consider just how fortunate we have been. Our students are in school. Our children are at the rink. We are able to participate in recreational and fitness activities, and we are able to visit loved ones outside of our household. Many other Canadians cannot say those same statements today. We are seeing jurisdictions being forced into another lockdown and businesses being shuttered for a second time. And when you see what others are going through, wearing a mask or downloading an app seem pretty minor. We want to prevent all of this from happening again in Prince Edward Island. This isn't about the cases here. This is about the turbulence we are seeing across the country, and for that reason, Dr. Morrison, as she has piloted us from day one until today, has, I guess to use the saying, Heather, that you've turned the seatbelt sign on to prepare us for what may be ahead. I will now pass it over to Dr. Morrison, who will provide more details on the measures and give us an update as to our COVID situation in this province. So over to you, Dr. Morrison.
Thank you, Premier. Good morning. There are no new cases of COVID-19 to report in PEI today. There remain 3 active cases in the province, and all 3 individuals continue to self-isolate and are being followed daily by public health nursing. Since the pandemic started, there have been 68 cases of COVID-19 in PEI. But as the Premier mentioned, we continue to witness the shocking number of new COVID-19 cases in Canada, the United States, and around the world. The second wave of COVID-19 has been described by others as a firestorm in other parts of the world. Previous records for case counts continue to be shattered day after day. The United States set yet another record for new cases in a 24-hour period and topped 1 million new cases in 6 days. In this country, we are at a crossroads in our fight against COVID-19. The situation in Canada continues to accelerate with almost 32,000 new cases in the past week, a 30% increase from the previous week. This represents an average of over 4,500 new cases a day. Ontario cases increased by 40% during the past week, Quebec by 25%, Manitoba by 41%, and Saskatchewan by 82%. These increases are in addition to significant increases in the previous 3 weeks. As of last night, New Brunswick had 28 active cases and Nova Scotia 23 active cases. The Public Health Agency of Canada is projecting that by December, there could be over 8,000 cases of COVID-19 per week in Canada. As a country, we are not yet bending the COVID-19 curve associated with this second wave of the virus. And as the case counts rise, health systems will become more overwhelmed. We remain fortunate in PEI as we have not yet experienced the second wave of COVID-19. And while we are in a good position today, we know that this could change at any time. I equate our current situation to anticipating a hurricane, where we know the track of the storm and the details of the potential impacts. And when we know there is a hurricane heading towards PEI, we do everything possible to prepare ourselves, our families, our communities, and our province for any potential devastation. So we need to take additional steps now to prepare for COVID-19 and protect ourselves and others. The pandemic represents a significant threat to our province, and we know that COVID-19 forecast based on the experience in other provinces, and we're watching it closely. We have been facing this threat since the beginning and need to remain steadfast as we confront this next wave. So as we monitor its impacts across the country, now is the time for Islanders to use all the tools in our public health toolbox to fight against COVID-19. Up until now, masks were strongly recommended in indoor spaces when physical distancing could not be maintained. And this is based on increasing evidence that mask wearing can reduce the transmission of the virus. While many Islanders are wearing masks faithfully, we can collectively do a better job to protect ourselves and others. So as the Premier mentioned, effective Friday, November 20th, 2020 at 12:01 a.m., non-medical masks or face coverings will be mandatory in indoor public spaces in Prince Edward Island. Masks will be mandatory in locations including but not limited to stores and retail businesses, restaurants, except when eating or drinking, art, sports, and recreation facilities, except during exercise or when masks cannot be worn, places of worship, government buildings where public services are provided, taxis and public transit, workplaces that are open to the public. Schools and healthcare facilities already have their own masking policies in place, and that will continue. Exceptions to mandatory masks include, but are not limited to, children under the age of 2, children under 5 who will not wear a mask, valid medical reasons, such as active breathing problems, but most people with underlying medical conditions can wear a mask safely, and anyone who cannot remove a mask without assistance. It is important to note that some people cannot wear masks for medical reasons, and that sometimes these reasons are not visible to others. Islanders and businesses are encouraged to be trusting and kind and show compassion and understanding. While not our first line of defense, masks provide another important layer of protection. Masks can supplement, but do not replace, other public health measures. So even when wearing a mask, it is important to maintain a physical distance of 6 feet from people outside your household. Islanders must continue to practice the public health basics to prevent the spread of COVID-19, including physical distancing, staying home when you're sick, good hand and respiratory and surface hygiene, and keeping your circle of contact small by limiting contact with people outside your household. How well a mask or face covering works depends on the material used, how it's made, and how well it fits. Masks should fit properly, covering the nose, mouth, and chin with no gaps. Masks should be made of tightly woven fabric and hold their shape after washing. Masks should be washed daily. People should continue to use their 2-layer masks, although the recent guidance from the Public Health Agency recommends 3-layer masks. As we replace our masks, we can purchase the 3-layer type. Face guards and spit shields do not replace masks. Our approach to enforcement of mandatory masks will be cooperative rather than punitive. Much like our neighbors in Nova Scotia and New Brunswick, we are relying on Islanders to do the right thing and routinely wear a mask when in public places. And we will have further details on mandatory masks and PEI on the website, certainly by Thursday, along with downloadable signs for businesses to post. To date, all cases of COVID-19 and PEI have been related to travel, and at least a third of our cases are workers who were required to travel for work or come to PEI for work. So PEI is at risk of importation of COVID-19. Today, I am updating the requirements for rotational workers, including what they must do when they return to Prince Edward Island. Our office recognizes that rotational workers are at greater risk of exposure to COVID-19. However, many rotational workers are in PEI for short periods of time, and it is important that they get to see their families. However, rotational workers are to avoid entering public places until their 14-day self-isolation period is complete, if they are in PEI for that length of time. Public places include schools, stores, malls, banks, places of worship, gyms, and restaurants. Rotational workers should not visit or host people from outside their household until their self-isolation period is complete. Rotational workers will continue to be tested at days 0 to 2, 4 to 7, and 10 to 12, and will be able to spend time with their family, go for walks off their property while maintaining physical distancing, access drive-through or contactless banking or restaurant services, groceries and essential items with that contactless process, and also medication. Rotational workers can attend necessary medical and dental appointments, but they do need to have a mask available in the event that they come in close contact with someone. Since the pandemic began, our office has tried to balance the risk of COVID-19 importation via workers with the need for them to maintain meaningful connections and spend time with their families. As the Premier mentioned, the upcoming holiday season is traditionally a time when people get together, with many traveling to spend holidays with loved ones. And it is understandable that families want to celebrate and spend time with family and friends over the holidays and enjoy our annual traditions. This year is like no other, with COVID-19 continuing to disrupt our routines and traditions. Given the incidence of COVID-19 across Canada and around the world, I do not recommend that Islanders travel outside of PEI over the holidays. 2020 may be the year to be very cautious and spend the holiday season at home. This may be the year to connect with loved ones virtually or by phone or by letter. I do not recommend that individuals and families travel to PEI for the holidays. As my colleague in Nova Scotia, Dr. Strang, has noted, for families with students attending school outside of the Atlantic bubble, the best option for them may be to stay right where they are and not travel home for the holidays this year. And that's hard to say, certainly hard for families. But family members who do decide to travel to PEI over the holidays from outside the Atlantic bubble must apply under the Family Connection stream for pre-approval travel and be prepared to self-isolate for 14 days when they arrive in PEI. Pre-travel approval applications should be submitted, as the Premier mentioned, by December 1st to allow adequate time to process applications and to facilitate planning for staffing throughout the holiday season. And while we're talking about travel in general, I think as I reflect on what's going on around the country, I would recommend that Islanders not travel off-island unless it's absolutely necessary, and that would be really effective right away. Holiday gatherings should be kept small to reduce the risk of transmission of COVID-19, and especially for the next 6 to 8 weeks, we need to continue to keep our social circles and our close contacts small. And while the personal gathering limit is 20 people, this number is permitted only if we can maintain physical distancing and respect that. So 20 is the maximum allowable, and smaller is always better. And the majority of homes may not be able to accommodate 20 people while ensuring that distancing is maintained. So I ask Islanders to use your judgment and common sense and only invite the number of people into your home that can be safely accommodated in the space while maintaining physical distancing. Advising people not to travel or visit loved ones over the holidays and to keep personal gatherings very small is not forever. And hopefully it's just for this smaller period of time. Regardless of how you plan to celebrate the holiday season, show kindness and respect for one another and following the public health measures, including staying home if you're not feeling well. So as I conclude here, by the end of this week, additional screening will be in place for people traveling to PEI at all points of entry. Individuals will be advised of the requirement to wear masks in public places, reminded of the other public health measures in place, and encouraged to download the COVID-19 notification app. During the next week, our office will be working with the long-term care and community care sectors to discuss potential changes to visitation guidelines. It is important that we balance the safety of seniors and others who live in care facilities with the need for them to socialize and spend time with their families and loved ones. While the prospect of a safe and effective vaccine is on the horizon, we have to do everything in our power to protect ourselves and our communities from COVID-19. The thought of some islanders receiving a COVID-19 vaccine as early as the spring of 2021 is good news, but we cannot get ahead of ourselves. We do have to take a cautious and measured steps to navigate through this second and possibly subsequent waves of COVID-19. The measures identified today will provide additional layers of protection for individuals and decrease the risk of importation of COVID-19 into our province. Keeping Islanders safe is our priority. I want to thank Islanders for their continued patience and understanding over the past 8 months. We would not be in the position we are in today without your cooperation and support. I want to extend a special thanks to the business community for their unwavering support. The past 8 months have been especially challenging for many entrepreneurs and private business operators. With the holiday season around the corner, I encourage Islanders to shop locally and support our island businesses and restaurants. I am pleading with Islanders and visitors to PEI today to follow the public health measures. Our individual and collective actions are critically important, especially over the next few weeks. We know our COVID-19 situation can change quickly, and we are taking all these steps to try to stay in our new normal for as long as possible. The best gift we can give to one another this holiday season is one where we have only a slow burn number of COVID-19 cases that we can manage, and that we have a safe holiday. As we continue our journey with COVID-19, let's continue to be patient and kind. Thank you.
The Health System Joint Response Team continues to be in an active monitoring and planning level, noting the increase in cases across Canada and around the world. As Dr. Morrison and the Premier have highlighted today, while our case numbers here are small, the current wave of COVID is all around us and potentially at our shores. Continuing to strictly follow public health guidelines, maintaining physical distancing, practicing good hand hygiene, and wearing masks when physical distancing isn't possible are critical in limiting the spread of the virus on PEI. Testing is another important component to containing this virus. As always, our testing clinics and laboratories remain very busy, but are prepared to meet the needs as outlined by the Chief Public Health Office. Yesterday, we tested 330 people across the province, and on average, we have been testing between 200 and 400 people a day. We also saw 16 people at our cough and fever clinics. And as a reminder, people who have cold and flu-like symptoms, who might otherwise have visited a doctor's office or nurse practitioner's office or an emergency department, are asked to instead make an appointment at one of our cough and fever clinics in Charlottetown or Summerside. We have added a new set of guidelines for visitors coming to us from outside Atlantic Canada who request entry to PEI to visit a loved one at the end of life at one of our facilities. Those visitors require permission from the Office of Public Safety and the facility in which their family member is receiving care. The traveler can request a visitor designation form from the facility approving them to visit, and this form will be submitted as part of their application to travel to PEI with the Office of Public Safety. After obtaining pre-travel approval, The traveler must arrange to be tested 3 times at our COVID testing clinics in PEI. The first test is within the first 2 days of arrival on the island, and they must have a negative test result before being permitted to visit. The visitor must also schedule retesting between days 4 and 7 and 10 and 12 after arrival on PEI. These designated visitors, while being permitted to visit a family member at end of life, must have a negative COVID-19 test result prior to visiting and wear full personal protective equipment, including masks, gowns, and gloves, when in any of our healthcare facilities. They will not be permitted to eat meals, use washroom facilities, or move about our facilities while visiting, but they will be permitted repeat visits if possible with their loved one. Facility precautions must be followed at all times by these visitors. These designated visitors as well must continue to self-isolate while not visiting for their first 14 days they're on the island. We ask all visitors to continue to follow the protocols and guidance at our healthcare facilities and long-term care homes closely, including wearing personal protective equipment and following any restrictions as indicated by staff. While we balance the needs of our current patients and families and our community, we are fortunate to have been able to reestablish most services to their usual level. I do want to remind Islanders that in many areas, the way we access services have changed. We require booked appointments for many services that were previously walk-in. This includes our blood collection, sample collection, or diagnostic imaging services. Contact information for how to make these appointments is provided to you by the family doctor or nurse practitioner or specialist when giving you the requisition for testing. It can also be found online on our Health PEI website. I want to recognize the efforts of everyone as we've progressed through this pandemic and feel grateful that we are where we are. As Dr. Morrison and the Premier have mentioned again today, we're only here because we've been doing this together. Thank you to all Islanders who are following the public health guidelines, keeping your circle of contact small, physically distancing, washing your hands, and wearing your masks. Thank you.
So I guess we will now open the line to some questions from our friends in the media.
Allison Sampson, CTV.
Good morning. With the number of cases in the Atlantic, do you view those provinces as a threat?
I would say that we continue to monitor very closely. I think that, as both Dr. Morrison and I outlined in our comments, that it's kind of been our suggested rule all along that you travel only when you need to, but we're sort of establishing that again today as a reminder for Islanders. I think overall I would say that it remains safe to travel today, but there is also increased risk in traveling to larger centers and other provinces where we've seen outbreaks. So we ask all Islanders to do that cautiously if they need to. And as Dr. Morrison has outlined in her comment today, that we would suggest you stay home for the next number of weeks unless you really need to travel.
And just to follow up, at what point would you consider closing to the Atlantic bubble due to numbers of cases?
Look, I think I'll take the first part and I'll ask Dr. Morrison to comment as well. But I think overall, from the beginning when we opened the Atlantic bubble, it was always under the pretense that providing that what the situations were in other Atlantic provinces with COVID, their potential outbreaks if they are to occur, and really what is their ability and from a timing perspective and a medical perspective in terms of their containment. So, I mean, that continues to remain for us, and we will monitor what's going on a daily basis. And we've said from the very beginning, if we need to go back on some of the protocols and procedures that we have enhanced forward, if we need to go back because the epidemiology and the reality tells us to do so, we're quite prepared to do that. But as of today, we are where we are at, and we will continue to monitor that. But maybe, Dr. Morrison, you could.
I agree. I think I'll just add that a bubble by its very nature is fragile. and we've all appreciated that. I'll be speaking with my counterparts in Atlantic, Canada later this afternoon on our regular call, and I know the premiers will be having similar conversations, and it is looking at what is happening elsewhere, but also what is happening in each of our provinces.
Thank you.
Jessica Doria-Brown, CBC.
Hello, it's a question for Dr. Morrison about moving towards mandatory masks. You said there aren't any penalties, but maybe you can go into a bit more detail about how this will be enforced and how you are expecting people to comply.
Hi, Jessica. I think I mentioned, for many islanders, since we've made a very strong recommendation months ago, people have been wearing masks in indoor public places. We know that masks are mandatory in many settings, in some businesses already. So for many places, that won't change. But I think it's important that there's consistency, that if there's any question about whether or not you should consider wearing a mask, this putting it in our public health order, which it will be, to make it mandatory is important as one more layer we've talked about, and one more public health measure that we can do, not replacing the other public health measures. We are in the process of discussing some of the ways it can be enforced. For instance, we've done, I think it's certainly well over 2,000 COVID inspections, and that's where we go to businesses and establishments. 2,300 COVID inspections have already been completed, and so as part of those COVID inspections, will our inspectors be looking to see, is there signage around masking, for instance, and are people wearing masks? We're in the process also of talking with our enforcement partners, but also legal, as they're finalizing the order about what that could look like. But really similar to Nova Scotia, New Brunswick, where they haven't made it about enforcement. It's really about cooperation and the expectation that islanders will comply to try to protect themselves, their families, and the community.
Okay, and along the same lines, just for individuals who can't wear a mask, will there be some sort of registration process or any way for people to identify themselves?
No, I think, as I mentioned in the notes, that there are certain medical reasons that people may not be able to wear a mask, exemptions, and we need to believe that we would ask islanders and businesses to respect that. They do not need to be registered. They do not need to go to a doctor's office to get an exemption letter. It is that we respect that, and there should be very few medical exemption reasons, and we know that, and those will be some of the details on the question and answer that will be updated and on the web in the next day or two.
And if I could just add, Jessica, to that, I think that we also have to understand that the large majority of islanders want to do and have done everything that they could do within their own abilities to make sure we are safe and make sure others are safe. So I do feel there's a tremendous responsibility that islanders have taken upon themselves to do this. I think islanders, even though it is inconvenient for sure, it's a lot different than what we've had to do in the past. I think islanders are understanding and want to do this. Islanders want us to be safe here. They want us to continue to have some of the measures that we've been able to enjoy, some of the privileges we've been able to enjoy. So we've had tremendous uptake on most or all of our protocols here in this province. And I think it's because islanders want us to get through this. And I think for many of us, we're hopeful that we're not at the end of this, but I think we can see the destination in the offing. We feel we're closer to the end than we are to the beginning, and we need just everybody to dig in a little bit longer here.
Okay, thank you both.
Alison Jenkins, The Guardian.
Hello, I'd like to ask about the case that was announced last Wednesday. Just wondering if any of the close contacts of the rotational worker were children.
So the close contacts we mentioned there were 6 close contacts, and they are in self-isolation. We usually don't identify ages of close contacts, and we haven't over the 8 months. So, but the close contacts, adults, children, any age, are kept in self-isolation, and all the close contacts will have repeat testing as well, and as part of our follow-up.
Okay, great. And my next question would be about the upcoming public health measures. It's kind of a two-part question. Does this mean that we're changing colors on that scale? And what areas do you expect will be coming under more regulations? Will it be similar to the early days in March where retail outlets and that kind of thing? Or, will there be lists of essential services? What can you give me a broad overview?
Maybe I'll start, and Premier can certainly add in, or Marion as well. So we are not moving into another level. I think some of the things that we've talked about today are some modifications where we're really hoping we can stay in our green level, or the new normal that we've referred to. But there was a reference here in one of our points that we are looking at, for instance, at some changes. We'll be working with long-term care at Health PI and in the private long-term care in terms of possibly some changes there, not stopping visitation, but certainly just some minor changes there, because that's a group that we know is vulnerable. So we're looking at that in the days ahead. But we would so we're not going into the yellow or orange caution zone at this point in time. But when we do, it would be, for instance, looking at gathering limit sizes, potentially. What are some of the higher risk activities within that? So there may be some modifications within that. We are sort of there's a list of a range of it. So would health services be affected, businesses, whether it's recreation, childcare? There could be modifications in that caution level. Again, we are hoping we don't have to go there, but we are looking at it on a regular basis and discussing what that may look like, the details of within that yellow or orange caution level. And we would not be going into an immediate lockdown that we saw earlier.
Yeah, and I would only add that I think we are taking some of these measures now as a precautionary effort, with the hopes we don't have to make steps backwards. And I think that, when I talk to Dr. Morrison, as we do daily, over the last number of days and weeks, we have been watching what's going on across Canada and around the world. And Dr. Morrison has talked about the fact that it's been the importation of this virus to our region and to our province that causes great concern. And when we look at the situation we're in right now with Christmas coming, and that being a time of year when people tend to want to get back and to gather and to locate together, because that's what the Christmas season is all about. So we are trying to be as proactive as we possibly can with the tools that we have in light of what's going on across Canada. I mean, we're still fortunate to be in the situation we're in right now, but when the Chief Public Health Officer of this province says that, Premier, I have great concern about what could come, then I think it's incumbent upon all of us to do everything we can. And that's not the Premier and the Chief Public Health Officer. That's each and every Islander, I think, has that responsibility to do their part. And that's why we're implementing these changes now.
Excellent.
Louise Martin,
Thank you very much.
CBC.
Hi, sorry. I couldn't get off mute. Apologies. Hello to both of you. So I'm going to get you both to potentially answer this question, and it is really about the masking again, and how worried you are about any potential pushback, given we know there are anti-maskers out there, even on PEI. I know Premier said you expect people to comply. with this, but there will be those who don't feel it's necessary given the low case numbers here. So are you worried about pushback? And then in that same vein, you know, someone goes into a retail outlet and a young frontline worker has to then sort of enforce a mandatory mask regulation on people.
Sure, you go.
Hi, Louise. I'll start maybe, and then the Premier can answer as well. As the Premier mentioned, and you indicate that there could be some that are not wanting to wear a mask, and I mean, I don't think anyone necessarily wants to wear a mask, but this is the expectation, and we think that this is one more tool that we can use to try to protect ourselves over the next coming weeks. And I would rather try to respond to those who may not think mandatory masks are a good idea than to be having to respond to others when we have widespread community transmission and we hadn't tried to put this additional measure in place. And so when we watch what's going on around the country, we have at least 5 provinces that have made masks mandatory. We have additional municipalities on top of that which have put mandatory masks in place. So I think this is why we're doing it at this point in time. In terms of the enforcement, I know that, for instance, Ottawa Public Health has in its order where they advise if someone walks in to a retail business or a store, they are advised verbally once that masks are mandatory, and if there's no compliance, they don't do anything further, and which is an interesting approach because we certainly don't want to create a confrontation with a young, with any of the staff, people in businesses. And I think that's why we've asked, I think one of the other questions was similar. We want people to be able to, businesses and islanders to respect those who might not be able to wear a mask and to be kind and understanding in that regard.
Yeah. And look, I would just add that, this has never been a game of gotcha or people looking to point out somebody not wanting to do something. I think it comes down to, as an individual islander, as someone who is from here, someone who wants to have some kind of normal life for it to remain, is what are you prepared to do that? I mean, I look at it from my own situation. I mean, I have my 2 youngest kids are able to play hockey. I can't go in an hour before like I used to and talk to everybody and walk around the rink. I have to wait in my car until I'm permitted to go in. I have to wear a mask. And is all of that a hassle? Yes, it is. I'll be honest. Is it a nuisance? Do I wish I wouldn't have to do it? Yes. But to me, the other choice is our kids can't do that. We're not able to go out and do those things. So I do think it is, look, there will be people who won't want to do this. I understand that. But I do believe as a province that we've seen a tremendous response from those who want to do their part to help and to get us through this. And this is just one more thing we need islanders to do. I think that there's a significant public pressure put on socially by each of us, toward each of us to do the right thing. And if this can help us get through to the end a little bit more quickly and to avoid islanders getting sick or islanders dying because of COVID, then I think all islanders will understand the need to do this. And I certainly encourage and appreciate the efforts that it will take to do it. But islanders are good people, and I think we'll see a tremendous uptake continue.
Thank you both, and I'll get you to both answer this next one as well, but I'll start with you, Premier, since the camera's already on you. And that is the recommendation for islanders not to travel off-island for non-essential reasons. And so I'm going to sort of look a little bit further ahead to the holidays. And I know lots of other provinces are also asking their residents not to travel outside of the province right now because of the rising numbers elsewhere. But for those people
who are considering traveling off island of the holidays within the Atlantic bubble. So I'm talking Nova Scotia, New Brunswick, Newfoundland, and Labrador. Is there a recommendation then to not do that? And I know, Dr. Morrison, you said the bubble by its nature is fragile. Are we going to see potentially that bubble burst, before the holiday season when people are making their plans now?
I'll let Dr. Morrison answer the second part of that. I think we continue to monitor the situation. It has essentially been our recommendation from the beginning that even though you were free to travel throughout the region, that we encouraged you to do so only if you needed to do so. And that continues, and Dr. Morrison has pointed that out again today. I hear a lot of people saying, I need to go Christmas shopping. You don't need to go Christmas shopping in Moncton. We have tremendous stores here in Prince Edward Island that you have been supporting, and we need you to continue to support here in Prince Edward Island, and we encourage you to do that. We have, incentive programs to keep you here to make it even more, cost effective, so we need you to understand as islanders what is a need versus a want here, especially for these next 6 or 8 weeks. It's just important that we recognize that the further we travel from our shores, the greater risk we have in terms of exposure to COVID. So we just want everybody to be mindful of that. As I say, if somebody is planning to come home, we have protocols in place that we need you to follow, and just like we've been doing for the last 8.5 months. But we are making that difficult statement, quite frankly, that if you're planning to come home this summer or this Christmas, and you're, I know you want to be here, but it would probably be best and safest for everyone if you didn't this year, and that's tough.
Yeah, I agree. It's these are tough things to talk about. They're tough things to put in place. They're tough things to live especially when your family and close friends may live elsewhere. I think the Premier has highlighted too, this is not going to be forever, and this Christmas and our holiday season could look a little different. I think the bubble and the travel within the bubble, it's hard to jump ahead a month from now, and so really we'll continue to see what that looks like, and in the days and weeks ahead. So it's hard to know. I know people like to make a lot of plans ahead of time, but I think as much as possible, we should stay closer, to home and stay in Prince Edward Island and not travel. And that's based on what we're seeing elsewhere. And if you do travel, make sure you're really following the public health measures that are in place elsewhere. We've seen lists of public exposures of COVID-19 in a number of locations in Nova Scotia and in New Brunswick in the last days. And so it's a reminder, it's not something, this virus is invisible in the sense that you're walking into a place and you're, and you may not appreciate that you are being exposed. So we're trying to do things that minimize the exposure, and then also the risk of importation and spreading of that virus here in our community. Of course, if anyone has symptoms, whether they've traveled or not, important to be tested so we can have early identification and quickly get our arms around any number of cases or outbreak of cases.
Okay, thank you to both. Appreciate your time.
Laurent Rigaud, La Voix acadienne.
Good afternoon to the three of you. J'ai une question pour vous, Dr. Morrison, en français. Est-ce que vous pouvez répéter tout simplement quelles sont les obligations pour les masques à partir de vendredi, s'il vous plaît?
Bonjour Laurent, et puis j'ai dû répéter ça en français, mais je m'excuse. Alors, obligatoire après le 12 01, le 20 novembre, les masques seront obligatoires dans les espaces publics qui sont à l'intérieur. Alors, ils sont dans les magasins et les business, les restos, sauf quand vous mangez ou prendre quelque chose à boire. Dans les facilités pour la récréation, où vous à l'église, les taxis, les autobus publics, les édifices gouvernementaux où les services publics sont offerts. Puis, il faut se souvenir aussi que les écoles et les facilités de santé ont déjà les masques sont déjà en place, ils sont déjà obligatoires sur les autobus pour l'instant et ça va continuer. Il y a les exemptions pour les masques pour les enfants de 2 ans qui sont moins de 2 ans et puis aussi les enfants de 2 à 5 s'ils ne veulent pas porter un masque, il ne reste pas un masque sur face. Il y a une exemption. Et puis aussi pour les raisons médicales, il n'y en a pas beaucoup, mais il y en a. Et puis il y a une exemption pour ces personnes. Et puis aussi pour les personnes qui ne peuvent pas enlever un masque eux-mêmes. Alors ça, c'est vraiment les grandes exceptions. Mais ils vont avoir plus d'informations sur le site web dans les prochains jours. Et puis aussi, l'information pour les business, ils peuvent enlever du site web et puis mettre juste l'information à propos des masques obligatoires.
Merci pour toutes les précisions. Vous avez dit que les insulaires, enfin, vous déconseillez de sortir de la bulle atlantique, même de l'île pour les vacances de Noël, de voyager à l'étranger par exemple. Est-ce qu'il va y avoir des changements au niveau des frontières du Canada? Est-ce que les règles vont changer pour tout le pays ou pour l'instant ça reste pareil?
À ce moment, ce que je comprends, c'est qu'ils ne vont pas changer la frontière fédérale, nationale à ce moment, mais je pense que c'est le cas. Alors, je ne pense pas qu'il va y avoir des changements à cette direction, mais I'll just translate in English, and the Premier may be able to speak to that too. The question was, do I anticipate any border changes for the federal border, and at this point I certainly don't anticipate any different changes between the Canada-US border at this time, but of course that's really a discussion at a different level. I don't know if you wanted to comment any further on that.
Just only that on our last First Minister's call we did have a conversation with Canada's ambassador to the United States, and we talked about border situation being what it is, and there's certainly no indication that that is going to change anytime soon, strictly because of the fact that we're in the sort of the teeth of this second wave, and it continues to be monitored, of course, and we continue to have trade back and forth, which is important to both countries, of course, but travel has been limited on a personal basis, and it will continue.
Thank you.
Sophie des Hôtels, Radio-Canada.
Oui, bonjour. La question est pour le Dr Morrison, en français, s'il vous plaît. Alors, pouvez-vous expliquer pourquoi imposer le masque obligatoire à l'intérieur en ce moment, alors qu'il y a très peu de cas dans la province?
Bonjour. Jusqu'à ce moment, on a fait des recommandations pour les masques à l'intérieur depuis quelques mois, mais on fait ça obligatoire cette semaine parce qu'on voit ce qui arrive partout au pays, le nombre de cas qui augmente, même les autres cas au Nouveau-Brunswick, Nouvelle-Écosse, et puis ça m'inquiète. Et c'est juste une autre mesure qu'on peut mettre en place. Ça ne remplace pas les autres mesures de santé publique, mais c'est une autre mesure et on veut qu'on fait tout ce possible qu'on peut rester dans le niveau vert ici, que c'est le new normal. Et puis, alors, je pense qu'on doit faire tout ce qu'on peut et toutes les mesures qu'on peut mettre en place de réduire la chance d'avoir les grands nombre de cas ici à l'île du Prince-Édouard.
Et également, pourriez-vous expliquer par rapport à la période des fêtes, la période de Noël, qu'est-ce que vous conseillez? Je crois que vous avez dit en anglais que vous déconseillez aux gens de sortir de l'île et que s'ils doivent le faire, ils doivent s'inscrire avant le 1er décembre. C'est bien ça?
Oui, alors, deux parties vraiment. Je vais commencer avec... s'il y a les gens qui sont hors de la boule, qui veut voyager ici, mais il faut faire une application vraiment. Et aussi, s'il y a des gens qui doivent voyager partout les vacances, il faut qu'on regarde leur plan d'isolement quand ils retournent. Alors, si on peut faire ça avant le 1er décembre, ça nous aiderait beaucoup à avoir la chance de regarder ces applications parce qu'on anticipe un nombre de personnes qui veulent voyager et c'est difficile pour le bureau, pour les gens qui regardent ces applications d'avoir le temps d'en faire. Alors, c'est pour cette raison. Et puis, c'est vraiment notre... quand on dit de ne pas voyager hors de l'île du Prince-Édouard, vraiment à ce moment, si vous ne devez pas aller, c'est juste parce qu'on voit les cas qui augmentent. Et c'est vraiment, c'est même sorte de choses qu'on dit dans les autres provinces. Je sais que mes collègues partout au pays disent restez dans votre propre province si possible parce qu'on voit les cas qui augmentent partout.
Merci.
Okay, merci.
Well, thank you very much to our friends in the media. Thank you to Dr. Morrison and Marion for being here, and stay safe.